Collaborative practice is critical to optimal functioning of healthcare. In the actual clinical settings, our healthcare professionals constantly face increasingly complex and novel situations, such as the recent COVID-19 pandemic that has ravaged the world and put our healthcare system almost at the brink of collapse. As the COVID-19 pandemic disrupts healthcare education, we need to demonstrate resilience and creativity by integrating two things: sound and well-established pedagogies and affordance of emerging instructional technologies to make IPE relevant and authentic in addressing the needs of times. The WHO, the Institute of Medicine, the University of Hong Kong, among others, recognize the need to break down disciplinary silos in favor of interprofessional collaborative practice. Collaborative practice, which recognizes the diverse roles, responsibilities, and expertise of healthcare professionals, is linked to the prevention of medical errors, improved service efficiency, patient safety and satisfaction, and improved health outcomes. In light of this, at the Lee Ka-shing Faculty of Medicine of the University of Hong Kong, the integration of interprofessional education and collaborative practice, or IPECP, into curriculum serve as a means towards achieving the goal of preparing healthcare professions to become collaborative practice ready. The IPECP is one of a kind, large-scale cross-faculty, cross-program, which is participated by content experts and students from 7 to 8 programs. We developed a spiral IPECP model with the E-SMART as defining characteristics, evolving continuously with strong E support, evidence-based, measurable, achievable, relevant, needs-based, theory-based. The spiral IPE is implemented with strong pedagogical and technological support that links learner and students beyond the classroom boundaries. In our quest to fine-tune the IPECP over time, we continue to evolve the program to make it evidence-based, relevant, and responsive to the needs of times. When COVID-19 resulted in disruption in education, the online synchronous and asynchronous interactive IPE is a viable option to expand students' exposure to large classroom interactions.
IPECP in our university follows a spiral or tiered approach to IPE. This three-tier spiral model is where activities are presented with increasing levels of complexity across the curriculum. Tier 1, Interprofessional Literacy, as a prelude to Tier 2, Interprofessional Simulation. In Tier 3, Collaborative Practice. The adoption of spiral approach ensures the attainment of collaborative learning competencies to prepare the students to be better collaborators. This program approach is consistent with the revised Bloom's taxonomy framework in Miller's pyramid of competence. The role of well-designed technology is crucial in the management of a large-scale, online, synchronous and asynchronous interprofessional education. In particular, various team-based activities can be accomplished through e-platform. Given the pandemic scare, the motivation of the eIPE is to provide authentic interprofessional collaborative activities for the teams at the convenience of their homes. For the asynchronous IPE, we put the teams composed of 5 to 7 complementing disciplines to complete team-based and case-based learning activities online. We provide the teams with meaningful preliminary activities with close e-monitoring from the technical side. The teams have independent meetings via Zoom to tackle clinical case scenarios and formulate interprofessional healthcare management plan through concept maps. Teachers come to provide feedback on their plans.
I Joining the IPE program, our students get a valuable experience to work with other disciplines. They can learn how to communicate with them and learn more about the other professionals in an informal way.
Through interprofessional education, they're able to learn to work as teams to bring out the best of each profession when caring for their patients.
And before students get into practice, it would be wonderful if they can engage in interprofessional education.
I'd say definitely get to know a team more. It wasn't every day that I got to meet my future colleagues when I was a student, but now I work with them day in and day out. And it takes trust to build a good team. And that starts from mutual understanding whether your colleagues' personality, their job nature, their work schedule. And it's never too early to start building this professional relationship.
I think they just need to know that each profession has its own role to play, and it's very important to have each and other input, because we each have our own expertise that would bring benefit to the patient, each and every patient.
Without those trust-building activities in IPE sessions, I will have more difficulty adapting to my work in the hospital, and patients will suffer from less optimized collaborative care.
For tips for the current students, I would encourage you to take this opportunity to ask questions and learn with your fellow schoolmates, because school is a place where you can learn and make mistakes.
呢個係一個好嘅提醒 ，IPE 俾咗我哋嘅係要學識點樣去 be humble， 去學習人哋嘅專長。但係另一方面，亦都我哋要 be confident， 我哋去代表住我哋嘅專業去同人哋合作，同人哋去 collaborate。咁所以我諗呢個亦都係我哋正喺 healthcare setting 成日講嘅 multidisciplinary。我哋要同人合作之餘，亦都要做好自己嘅範疇。
The reach and impact of IPECP in our community is expanding. Because of the positive feedbacks, we are currently extending our program to involve occupational therapy and physiotherapy students from Tung Hua College, the Open University of Hong Kong, and Caritas Institutes of Higher Education. We're scaling up the program to include faculties of law and engineering. Currently, we are planning to internationalize our IPECP curriculum through active negotiation with the University of College London School of Pharmacy. With our success in implementing IPECP, each implementation design is now used to scale up the delivery of E-triggered problem-based learning, or EPBL, at the Faculty of Medicine. Similar to online IPE, EPBL is a student-centered approach composed of small group discussions after self-directed learning and whole class debriefing. The group solved authentic open-ended clinical problems to develop critical thinking, communication skills, and workplace collaboration. Interaction within and between the teams will be monitored using group meeting mediator to enable students to be more engaged, less dominant, and increase engagement and achievement.